The United States, the EU, and other actors say that their sanctions aren't targeting the health sector in a negative way. What do you say about that?
Well, I would say that unfortunately it's not the case. I could see a very clear impact of unilateral sanctions plus over-compliance with unilateral sanctions to the health sector in Syria. And unfortunately, the impact is very high. In accordance with WHO reports, the level of healthcare in Syria before 2010 was pretty high. It was considered to be one of the best in the region. Today, it's not the case. I will give you a few examples. So one of the first problems is that unfortunately today, due to the military hostilities, many health institutions have been destroyed, including many hospitals, and that means that equipment in these hospitals has also been destroyed. Lots of doctors or nurses have been killed or have migrated. So the country is facing very serious challenges as concerns the access to necessary equipment and access to necessary medical treatment. So many hospitals are moved to inappropriate for hospitals building. For example, they used a regular clinic for a traditional hospital, and there is a challenge to use for it, for example, for intensive therapy, or to use it for surgeries. Some of the impact on the functioning of clinics have nothing to do with the health sector directly, but it's a consequence of other problems, like, for example, the shortage of electricity. So when we speak about the shortage of electricity, in accordance to the statistics, the huge part of the territory has access to electricity per 2 hours or 4 hours per day. Hospitals are prioritized in getting access to electricity, but even for hospitals, the access to electricity is guaranteed for 10 to 12 hours per day. That's not sufficient, for example, to store the medicine in the cold storage or, for example, to store the vaccination. That's why, for example, there are multiple reports about the outbreak of diseases which didn't exist before because of the vaccination. And there are outbreaks of tuberculosis, of polio, of measles, as well as other diseases. As a result, due to the impossibility to store and to have access to this medicine from one side, and secondly, due to the huge number of internally displaced persons and street children, which not all of which are registered, the level of vaccination dropped enormously. So under the statistics which I have seen, currently it's 68-65%. So it's much lower than it used to be before 2011. Second problem is the access to the necessary medical equipment. One of the problems is to get to the hospital. In the face of the shortage of fuel, in the face of the problems with transport infrastructure, for example, railway infrastructure is affected around 80% due to the military hostilities. There is no possibility to buy new spare parts or to buy new buses, to travel by buses. So quite often it's a challenge to people to get to the hospital. The third problem is that the number of hospitals is lower now because the number of doctors is lower. If people get to the hospitals, it appears that there are problems to get the necessary testing, to get the final diagnosis, or to get a necessary medical treatment. Formally, medical equipment and medicine are exempted from unilateral sanctions. Unfortunately, in practice, it's not like that. Due to the fact that there are multiple threats to all institutions dealing with any sorts of products, including the produce and the medical equipment, if they get payment from Syria, due to the fear of banks to have anything to do with Syrian banks or anything to do with things, goods directed to Syria, there is no possibility to pay, so to buy goods. So first problem is to pay. Second problem is that producing companies reject to sell anything what is directed to Syria. So basically, quite often I have received reports from a number of civil society actors which say that we are lying. We are saying that these goods or this equipment is directed to Lebanon or is directed to Jordan. and we buy it then, and then we try to deliver it to Syria. There are multiple reports, for example, that spare parts for the equipment which is already in Syria, let's say, brought in the personal belongings by specific private actors or private individuals just to restore the function. And I visited a few hospitals, and they said, oh, we have here a very old equipment. It didn't function for several years. However, we finally received a spare parts which has been brought by a private businessman in his personal belonging across the border. So unfortunately, due to the fear of companies, due to the fear of donors, and due to the fear of banks in the face of threats to have anything to do with Syria, there is a very serious shortage of spare parts and of equipment. I will give you an example. I was visiting an onco hospital, cancer hospital in rural Damascus. And one of the means to test cancer at the early stage is CT scanning. And when I asked what is the line for CT scanner for people who have been suspected to have cancer, the response was 6 months.
Wow.
And when we speak about cancer, it's necessary to identify it, so diagnose it at the early stage to be able to treat it. After 6 months, it's definitely not the early stage any longer. That means that the mortality rate for onco patients are much higher now than they used to be before 2011. Similar situation has been reported about other types of diagnostics, so several hospitals have shared with me the lists of medical equipment. Quite often medicine is not available. Many hospitals say, for example, that they have to request patients to come for example, to dialysis or to chemotherapy with their own catheter, because the hospital was not able to buy catheters or to request to buy catheters. A similar situation exists with medicine. Before 2010, Syria has a pretty developed system of pharmaceuticals production. And, however, as it usually happens around the world, the developed system of pharmaceutical production doesn't mean that the country produces all raw materials for production of these pharmaceuticals. That means that the pharmaceutical production depends on the maintenance of the equipment to produce pharmaceuticals, first of all, and there is a very serious challenges to get spare parts and to maintain the equipment, especially take into account that many producers reject to sell anything to Syria and moreover to provide post-sale services. That basically mean that it's not possible to do the regular maintenance and to fix it if something is broken. And secondly, there is a problem of raw materials. It has been reported that many companies reject to deliver necessary raw materials. So raw materials come from different countries now. Some of them come in the alternative ways. That's why it has been reported that the quality of raw materials is much lower. And naturally take into account that people try to pay attention to their health, especially in the urgent situation. It's reported that there are lots of medicine on the black market. Lots of them have been smuggled. And quite often the quality of this medicine is very far from being a good one. So basically I can say naturally, some medicine and some medical equipment is delivered, especially with the assistance of the United Nations. I have been reported that UNICEF is engaging actively. But unfortunately, what is delivered is very far from being enough to satisfy the needs of people. And moreover, unfortunately, due to the shrinking revenue of people and shrinking incomes, many people are not able to get the treatment in private health sector as they used to have it before 2011. So they moved to public sector. That means that the burden over the public health sector is much higher now than they used to be before. And when we speak about the health sector, I also need to mention the issue of the professionals. It has been reported that due to the fact that salary in the public sector is enormously low now in comparison to the food basket. I will give the clear example. Average salary of the doctor, so the professional doctor in the hospital, is around $30 per month. And when we speak about the top-level professionals like the heads of hospitals, it's around $40 per month. And the food basket for a family of 4 persons, so only food, is around $100 per month minimum, so with all possible subsidies. That basically means that the higher level professionals in the health area, many of them migrated, or many of them looked for the possibility to work in the private sector or to change their job. That's why every hospital reported on the shortage of higher level professionals. In many hospitals, there are many very young doctors who have just graduated, who do not have this experience. One of the most striking examples was when we were speaking about serious surgeries. It has been reported that for the most serious surgeries, there are only 2 higher qualified anesthesiologists for the whole country. That means that many people, even if you have the necessary equipment, are not able to get the surgery in time.